Good morning. Thanks for joining me at Cuddles and Milk in Petaluma today. Happy Labor Day. I am going to talk about a breastfeeding journey. This is episode 2, and ironically, it falls on Labor Day, talking about what happens at the end of labor when your baby is born. So this is a really important time, and I really want to spend a few minutes discussing this in the breastfeeding journey. So there's a lot that we can do later to try to fix things, but as with all of life, prevention is key. So if we can set people up correctly, then there's a lot less work later. Fixing a breastfeeding or a breast milk struggle with supply or baby latching, all of that's so much harder than it is in the beginning if we can get things going correctly. So let's start by talking about what should happen when a baby's born and what to do when that doesn't happen. So what should happen is in a vaginal birth, when the baby is born, baby should be lifted up and put on your stomach. And let me say, I was a labor and delivery nurse in a hospital for 15 years. Okay, I've been at thousands and thousands of births. I've worked in small rural hospitals. I've worked in, the best teaching hospitals and big hospitals that had 600 babies a month. So I've seen it all. Okay. And I know that this doesn't always happen, but let's go with the idea that this is what's going to happen. Baby's going to be set up on your tummy. Usually there's a towel there. They dry off the baby really quickly. They then pull that wet towel out, put a nice dry baby blanket on, usually a dry, warm one from the blanket warmer, and then put the baby on your skin to skin with the warm blankets over the two of you. So ideally, that's pretty much what's supposed to happen. And then you're supposed to be left alone. I don't mean everyone needs to leave the room. I mean, they need to not take your baby from you. In an ideal delivery with, somebody who knows what to expect and what they want to have happen, baby stays there. Baby lays on your tummy. They don't come off. They don't get weighed. They don't get measured. They don't have anything happen to them. Even their shots can wait 2 hours, right? A weight can wait 2 hours. You don't need to know. Baby's not going to change their weight in the next 2 hours of life. So you can just hang out. Now, what happens biologically in those first 2 hours is crucial. Baby comes out a little bit shell-shocked. I mean, let's be honest, it's labor for everybody, okay? It doesn't look all like a piece of cake from the baby side either. So babies come out a little bit shell-shocked, sleepy, kind of not sure what to do, but then their biological instincts kick in, that sense of smell, right? They're born with a stepping reflex. If you take a baby and hold it like this, a newborn, they will take their feet and go like this and try to step. It's crazy. That goes away after 2 weeks, okay? That reflex is there just to help the baby climb up your body, right? To crawl up your body. It's called the breast crawl, to get to the breast. That's it. Okay, that reflex is only built in for that first feed. That's incredible. That is nature helping us get the baby to where it needs to be, right? Your areola is darkened during pregnancy. That's to help baby find them, right? Baby's used to your scent. All of these things are to help the baby get to the breast, to ensure survival of that baby, right? To ensure your child gets its nutrition it needs, gets its medicine it needs in the breast milk, and is going to be okay. So I see a couple of people have just joined in. Post a comment. It'd be great to hear from you. Tell me what you need and how I can help today. Okay. So hello and welcome from Cuddles and Milk Petaluma. So again, that baby just got there and hanging out on your belly. In the first 2 hours of life, baby should do the breast crawl. If left alone, if hanging out on your tummy. Now, a lot of times in hospitals, they want to pull that baby off, do the weight, they want to do the shot, they want to measure, they want to get everything done. They want to get their boxes on that paper checked off so that they can move on, right? They want to be able to, hi, Ashley, thanks for joining. Happy to see you today. They want to be able to move on and get their work done so they can get you off to the next floor because they're slammed, okay? Great. I appreciate the fact that they're busy. I've been there. I know how busy it can be in the hospital. However, this is your one day, okay? You don't get to do this again. You don't get to recreate that first breastfeeding again. So take that time. Say, time out, nurse. Hang on. I need to breastfeed. Can't the wait? Can we measure the baby later? Can we weigh the baby later? That doesn't have to happen right now, correct? So let's wait. All right. So those are things that should wait. Even the baby's first shots, vitamin K, erythromycin eye ointment, they don't need to happen the second the baby's born. Baby needs to stay here, smelling you, doing that breast crawl, trying to get to the breast. Okay. And I've also seen the other side where some really well-meaning nurses are trying to help you breastfeed. Okay. And they're in there going like this and like taking baby and shoving it on the breast, like really, which is okay to do at different times. But in those first 2 hours of life, baby should be the guide. Baby should be leading the show. Okay. They know what to do. If we just stand back and give them some time, you'd be surprised what babies can do. All right. So let's let them do that breast crawl. Let's let them find the breast and get there. And then when they're trying to latch on, sure, help them. Okay. You can change position a little bit. The breast crawl basically is baby and you feeding in this laid back position. So you're leaning back in the bed or, got some pillows behind you. Your shoulders are nice and relaxed and baby is up and down across your body coming up in. And what's great about that is it puts baby in the best latching position, right? You wind up getting baby's chin into the breast like this. Their nose has room to breathe. They've come up to the breast. The cutest thing is when you get these two little hands on either side of the breast. It's adorable. Okay, so that is what we're looking for. We want to give the baby those first 2 hours of life to just hang out and try to get to the breast and let their biological instincts kick in. Okay, that's what should happen. Now, what about when it doesn't happen? Okay, so when it's optional, when it's the nurse saying, hey, baby seems sleepy, I'm just going to weigh it and clean it up real quick. I'm going to do a quick bath and get you guys off to postpartum. Okay? That's when you say, time out. It hasn't been 2 hours. Baby needs to stay right here. As long as the baby is breathing well, we're not worried about blood sugar, like health-wise is safe, they need to stay right here. Okay? And you say that to the nurse. Say, is anything wrong with the baby right now? Well, no, I just want to check the baby's vitals. Oh, cool, great. You can do that on my chest. You can totally check baby's temperature, heart rate, and respirations on my chest. I've done it many a times. They can absolutely do it on you. There's no reason to take baby off for that. Really, what it comes down to is they're busy. They're trying to move you out to the postpartum floor. Again, great. I've been there. They can wait. This is your one chance. Okay. This is your one first feed. You don't get to do this again. Okay, so spend those first 2 hours. Now, sometimes it's medically necessary. Maybe baby's not breathing well. Maybe the blood sugar is really low. Maybe baby is having, some sort of issue and it needs to be helped immediately. Then, yeah, airway trumps breast milk any day. Okay, air is life. If you're not breathing, you're not going to be okay. So, absolutely, then do whatever the docs say. If they say baby needs to come over to the warmer, baby needs to go to the NICU, baby needs to be watched, then that's what you do. There's no second thought there. I mean, we're not even considering that. I'm talking about when everything is normal. But if it's not, then baby goes off and that's totally fine. And then in that case, someone should teach you how to start hand expressing. Okay, hand expression is crucial. All right. So hand expression is a really big thing. You should be taught that in the hospital very early. You should be able to hand express. Some women can do it at the end of pregnancy as well. But if you can't, that's okay. After birth, start working on it. Start coming in and massaging the breast. If you can't get anything out, that's okay. Stimulation is great. And just kind of keep that going. Okay. If you can't get anything out, a spoon is your best thing because it has a nice little handle, an easy little reservoir. It's great and easy. Okay. I love using a spoon the first few days. It's just such a handy little thing and much easier for you than trying to hold a tiny cup. But we'll talk more about the rest of breastfeeding at the hospital in episode 3 next week. But this one, I really wanted to focus on those first 2 hours of life. So ideally, those first 2 hours, baby gets to spend on you. Even if they don't breastfeed great, even if it didn't go well, that is where they're supposed to be. Okay? So I hope they get to stay there. I hope you get to snuggle your baby. And I hope you check me out more on Instagram or Facebook at Cuddles and Milk Petaluma. and tell me what you think of the video. Tell me what would be helpful. Ask questions. I'm going to start another series soon going, is it normal? Okay. And then we'll discuss all of those things. So come, let me know what you think. All right. Happy Labor Day. Congratulations to all the moms out there who went through labor. Bye.